welcome you all for this video lecture. Myself, Dr. V Subramaniyan, Assistant Professor, PG and Research Department of Biotechnology, JJ College of Arts and Science, Pudukkottai. In this video lecture, I am going to discuss about vector-borne diseases. First of all, we want to know what is vector-borne diseases. Vector-borne diseases are illness that are transmitted by vectors. The vector means the mosquitoes, ticks, and others. The vector carries pathogens such as virus, bacteria, and protozoa, which can transport from one host to another host. So, this type of diseases is called vector-borne diseases. Okay, then we go for malaria. Malaria is one of the vector-borne diseases. Malaria is the diseases caused by the parasite. The parasites is spread to human through the bits of infected mosquitoes. The people who have malaria usually feel very sick with a high fever and chills. While the disease is uncommon in our temperate climate, malaria is still common in tropical and subtropical countries. Each year, nearly 290 million people are infected with the malaria, and more 4 lakhs people died of these diseases. Then we go for causative agent. What are the causative agents for malaria? Malaria is caused by Plasmodium species. The Plasmodium is one of the species. It causes the malaria. Some species are Plasmodium falciparum, Plasmodium vax, Plasmodium malariae, Plasmodium ovale. These are all the Plasmodium species. It causes malarial symptoms in various levels. Then we go for transmit. How the malaria is transmitted from one person to another person. In this slide, primary vectors. That means that mosquitoes. The mainly female Anopheles mosquitoes is involved for transmission of malaria disease one person to another person. The life cycle of this parasites. It first enter into the bloodstream during the mosquito pit, then it travel into liver to multiply, then it infect red blood cells, then it releases some symptoms. Then what are the other modes in the sense the blood transformation, organ transformation, contamination needles? These are all the factors to transport the disease. Then we go for symptoms. What are the symptoms expressed in the malarial disease? The uncomplicated malaria, that means it's common symptoms like high fever, chill and sweating, and headache and muscles ache. These are all the vomiting. These are the common symptoms expressed in malarial people. The severe malarial symptoms in the sense there's anemia, that's severe anemia, respiratory distress, then acquired kidney injuries. These are all the some major injuries or major symptoms expressed in the malaria infected person. Then we go for diagnosis. What are the diagnosis steps in this malaria? First one is a clinical diagnosis. Based on the symptoms and travel history, we can identify that patient affected by malaria or not. Then the laboratory diagnosis. The laboratory diagnosis in the sense initially in the microscopic studies, blood smear to identify the parasites. So basic techniques. Then we go for rapid diagnostic test, RDT. It can detect the antigens, then PCR, that polymerase chain reaction. It's high sensitive for parasite detection. Then we go for prevention. Uh, how to prevent that malarial disease? First one is vector control. Vector control is the major process to control the malarial disease. In this insect treated pet net. This is the ITNS. Then indoor residual spraying, that's IRS. Environmental management to reduce the mosquito breeding site. These are all the common steps involved to prevent that malaria disease. That then the personal protection. Usually, there are several outer protection. So personal protection is there. It is avoid outdoor activity during peak, then mosquito activities, and anti-malarial drugs like hydroxychloroquine, doxycycline. These are all the drugs we can control or we can prevent the disease. Then vaccination, RTS and ASO one. These are some common malarial vaccines. We can able to control that malarial disease. Then we go for another one, vector borne diseases, or like that is dengue. Dengue is the mosquito borne viral infection caused by the dengue virus, transmitted primarily by Aedes aegypti mosquito. It is a significant public health challenge in tropical and subtropical region. Then we go for causative agent. That the causative agent in the sense the dengue virus caused by some flavivirus family. Then dengue viral is some four type of serotypes is there. That dengue virus 1, dengue virus 2, dengue virus 3. Then transmitter, then we go for a transmitter. This transmitter in the sense how that dengue virus transmitted from one person to another person. By in this way, this primary vector is the mosquitoes. Mosquitoes is the primary vector, transport that dengue virus into one person to another person. And then the day beating the mosquitoes, this is the main reason for transport the disease. While and then we go for life cycle of viral mosquitoes. So the virus enter into the mosquitoes when it spits an infected person. Virus multiply in the mosquito's salivary gland, and it transmitted to the next person, the mosquito bites. These are all the some common ways to transfer the dengue virus into one person to another person. Then we go for symptoms. Symptoms of what are the symptoms occur in dengue virus? The dengue virus is common symptoms is high fever, that means 40 degrees Celsius. Another one is severe headache, pain behind the ears, joint and muscles pain. These are the common symptoms. And severe dengue damages is called abdominal pain and vomiting and rapid breathing, the some other organ damages. These are all the severe symptoms expressed by dengue virus. Then we go for diagnosis. What are the diagnosis steps is there? First one is clinical diagnosis. Based on the symptom and travel histories, we can identify the